Hello, everyone. I'm Solome Tibabu, the director of the Upswing Fund for Adolescent Mental Health. Really excited to be back with another Ask the Expert session. Today, I'm very pleased to have Dr. Virgil Moorhead, Executive Director of Two Feathers. Dr. Moorhead, thank you so much for being with us. When we get started by some introductions.
Yeah, I'm glad to be here. My name's Virgil Moorhead Jr. I'm the executive director at Two Feathers, which is in Humboldt County, Northern California, about 5 hours north of San Francisco. I'm part of the Big Lagoon Rancheria, which is Yurok and Tolowa Native Americans. And Two Feathers, we serve all Native Americans in this area.
Amazing. Well, we're very excited to partner with you and the Upswing Fund. Can you tell our audience a little bit more about the unique mental health needs of the Native youth you serve?
Yeah, I think the unique needs are that it is history, politics, and the rural part of where we live. And so, if you think about history first, we have experienced many years of colonization and structural systemic injustices, and so we have to take that into consideration when we're working with Native American youth. For example, the gold rush and what happened with some of our youth great grandparents, and so that is definitely in their consciousness and in on their minds sometimes. And so the history is important. I think the politics, and just in the sense of the lack of resources that are often in many parts of rural America very much affects our families. For some parts of our local reservations have upwards to 50-60% poverty rates. So I think that impacts mental health, those sort of political structural issues. And then I think there's the cultural piece that's important, that very much a big part of our Native American youth in this area feel strongly about their culture, their histories, their cultural practice, and there's ways of being. And I think that's an incredible strength. And so when we're working with Native American youth in our area, we have to take into consideration that history, that politics, the rural part, and the culture, and use that as a strength to promote mental health, wellness, and thriving.
You've already started to allude to this a bit more, but can you talk how does Two Feathers leverage culture-based approaches with not only attracting but serving Native youth and their mental health and emotional needs?
Yeah, I think one of the things we always say at Two Feathers is it's all about the engagement. It's all about the connection. And so we try to put on as many sort of positive activities, events, programs that youth are interested in. So being youth driven, and because if you don't have people show up, you don't have any services. And often those that have been through experience a lot of the sort of multi-generational complex trauma are the harder to reach. And so what we try to do at Two Feathers is really think deeply and really be proactive on reaching Native American youth. So what that means is doing home visits. What that means is being in the schools. What that means is being really flexible in our interventions and really being youth driven in the sense of for like convention, like more mainstream, talk therapy. If a youth wants to talk for a couple hours, we sometimes do that. If they want to talk for 10 minutes, we do that. And then during the pandemic, we've been really creative, such as going for walks on the beach, and because of social distancing, going for bike rides, and that being our mental health individual counseling session. And so I think that sort of really, concentrating on engagement and getting people, youth, and bought into the services and having trust, and then being really creative with the actual interventions that we're doing.
Mm-hmm. It's just wonderful to see how you've really tailored your services to fit the needs of the youth you serve. And sounds like something that I want to be a participant of.
Oh.
So really amazing. But with that, how do you know what you're doing is working? And how do you track those kinds of things?
Yeah, I think for right now as an agency, how we know that, we're successful is like I just said, that if the kids show back up, uh, and if they're engaged in the services and they're reaching out, during these times over the last year and a half, we've had numerous youth reaching out on their own. I think so that's a success. I think when we look at our referrals, and the referrals and people asking for help are coming from not sort of like county professionals, but actually families and kids that are asking for services. And so right now, I think it's really them asking, them showing up, and the relationships. I think that really, working on developing like developmental relationships, which I mean, where you're working on such things as, what does it mean to trust? What does it mean to give trust, receive trust? What does it mean to feel safe with an adult? Those kind of things that are very relationally based, I think is another measure of success. So I would say, people coming back, and I would also say that the trust and the relationships. And the third piece is, which I think is very important in Native communities, is the trust from the community, the trust from whether it's the tribe, we're our own sovereign nations, or whether it's, respected cultural leaders, or if it's, whoever else. But the trust at a sort of larger level, trust built on social media, like, you can promote who you are, what you're about on social media, and help with the trust building within the community. But I think at a sort of more macro level, that third piece is trust. If word of mouth, like if the community, our Native community, trusts you and respects you, that's incredibly important, because if you don't, they're not going to come to services. Then you're not going to be able to build the relationships that the research shows is so important to successful mental health outcomes.
There's so many good pieces in there. And I know we've a lot to learn from this excellent example of the work you're doing at Two Feathers. Dr. Moorhead, I wish we only had more time. Thank you so much for joining us today.
Yes, thank you for having me.